Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I'm going to take a few minutes to tell you about a medication called amiodarone or cardarone, which is one of the most successful medications used in patients who have electrical rhythm problems in their hearts. Amiodarone is a unique electrical medication in that it blocks the short circuits, blocks the abnormal pacemakers, and prevents the fibrillation which causes electrical problems in the heart without weakening the heart muscle. Virtually all other medications which affect the electrical system of the heart weaken heart muscle strength. Heart muscle weakening from medication can be bad since many electrical problems weaken the heart directly. Occasionally, the combination of a weak heart, further weakened from the electrical storm, and the additional weakening from the heart medication produces cardiovascular collapse and death. The importance of this was shown in the very famous FACC study in which over 1,400 patients with weak heart muscles and frequent PVCs were split into two groups. Half received placebos, the other half received the electrical medications flecainide or ancainide. These medications dramatically reduced the number of PVCs by over 90%. However, by the end of 1 year, there were 2 to 3 times as many sudden deaths and total deaths in the groups treated with flecainide and ancainide compared with the group which received the placebos. Both flecainide and ancainide are known to reduce the strength of heart muscle. Amiodarone, however, does not cause weakening of the heart muscle and is far safer. In fact, amiodarone has been shown to improve survival in heart patients in several studies. 3 of these studies looked at using amiodarone in high-risk patients who had a recent heart attack and frequent PVCs. Dr. Cheremiski took a group of 613 patients who had survived a heart attack and had frequent PVCs. Half received amiodarone and half received placebos. In the following year, 21 patients died in the group receiving amiodarone, while 33 patients died in the group receiving the placebo. Virtually all the deaths that occurred were sudden and presumably due to severe electrical storms such as ventricular tachycardia and ventricular fibrillation. In the BASIS study, Dr. Burkhart and associates took 312 high-risk patients who had recently survived a heart attack and who also had episodes of ventricular tachycardia and split them into 3 groups. One group received a placebo. One group received electrical medications other than amiodarone, and the last group received amiodarone. After 1 year, 13% of the placebo patients died, 10% of the patients who took other electrical medications died, and only 5% of the patients died in the group that took amiodarone. In the small CAMIAT pilot study involving only 77 high-risk patients who had survived a recent heart attack, amiodarone was shown to reduce overall death rate by half. Again, you can see the clear advantage for those patients treated with amiodarone. The STAT-CHF trial took 674 patients with congestive heart failure from weak heart muscles. Half received placebos and half received amiodarone. After 4 years, there was only a slight improvement in total mortality in the group given amiodarone. However, 64 patients died suddenly in the group who received amiodarone compared with 75 in those who received the placebos. 40 of the patients died from worsening heart failure in the group who received the placebos compared with 34 in those who received the amiodarone. Putting these studies together, amiodarone appears to be helpful in the average patient with congestive heart failure who also has frequent PVCs and ventricular tachycardia. The third area where amiodarone appears to be very helpful is in the prevention and management of the electrical storms involving the top part of the heart, such as atrial fibrillation and atrial flutter. The success of amiodarone in restoring normal sinus rhythm in patients with atrial fibrillation is anywhere from 40 to 95%, depending on the dose of amiodarone used, the length of time the patient was in atrial fibrillation prior to using amiodarone, and whether or not electrical shocking was used to restore normal sinus rhythm. If atrial fibrillation has been present for less than 1 month, the success of amiodarone in restoring normal electrical activity of the heart is over 90%. In patients whom atrial fibrillation has been present for a year prior to the use of amiodarone, the success rate may be as low as 40%, but improves to 60% when electrical shocking is used after amiodarone therapy has been initiated. The major advantage of using amiodarone in patients with atrial fibrillation is that it is successful in restoring normal heart rhythm, the risk of having a stroke is reduced significantly, and there is no requirement to take the blood thinner called Coumadin. The final area where amiodarone appears to be very helpful is in patients who have developed sudden cardiac death. In the Cascade study, over 228 patients who had survived a cardiac arrest were given either amiodarone or another electrical medication chosen on the basis of an electrophysiologic study. Within 4 years, a second cardiac arrest occurred in 48% of the patients treated with the other electrical medications compared with 34% of the patients who received amiodarone. In summary, amiodarone is an extremely effective medication for controlling electrical problems in the heart from short circuits or from fibrillation. It has been proven to be effective in improving survival in patients after a heart attack who are at high risk of sudden death, patients who have congestive heart failure and frequent mini electrical storms such as PVCs or ventricular tachycardia, and in patients who have survived sudden cardiac death. It is also useful in patients who have developed atrial fibrillation and other electrical problems in the top part of the heart to restore the normal electrical beating of the heart. The next issue with amiodarone is how to take it. There are 2 ways. The first is orally, and the second is intravenously or through the vein. The oral method is preferred since it is much less expensive than through the vein. Amiodarone comes in 200 milligram pills. The normal way to start amiodarone is to take 2 pills 2 to 4 times per day for 2 months and then to reduce the dose to 1 pill per day. The reason for taking up to 8 pills per day initially is that the level of amiodarone must be built up for it to be effective. Fortunately, amiodarone has a very long half-life. That is, it takes the body a long time to get rid of it. Hence, once a therapeutic level has been obtained in the blood, the dose can be reduced substantially while maintaining the effectiveness. Amiodarone has been used extensively in Europe for more than 20 years. It has not been used very much in the United States until recently. The reason for its limited use in the United States has been a change in the way it was given. We now realize that the dose of amiodarone that is effective is much lower than what was previously used. When lower doses of amiodarone are used, that is 1 pill per day, toxicity is reduced tremendously. When used in low dosages, amiodarone improves survival and prevents hospitalizations. The use of low doses of amiodarone after an initial loading dose for 2 months has been a tremendous advance in cardiology. It is, however, recommended to follow patients who take amiodarone very carefully. There are several safety checks which we routinely perform on patients at 3 to 6 month intervals to be certain that no bad side effects occur. The routine tests are complete blood count, or CBC, thyroid hormone levels, cholesterol checks, liver checks, and lung or pulmonary function testing. In addition, it is recommended that a chest X-ray be performed at 6-month intervals along with an ECG. The reason for checking these tests at 3 to 6 month intervals is that when amiodarone is used in high dosages, problems developed in these areas. When problems are detected early before any permanent damage is done, stopping the amiodarone will return things to normal. Amiodarone can affect thyroid hormone levels. Approximately 8 to 20% of patients who take amiodarone for a long time will need to take thyroid hormone replacements, compared with 2 to 3% of the normal population. Amiodarone can also cause a mild increase in the normal wear and tear on the liver. Since it is normal for some liver cells to die every day, there will be a normal amount of ALT in the blood each day. This normal loss of a few liver cells each day is what we call normal wear and tear. The liver has excellent regenerative powers and can easily replace 3 times as many cells on a daily basis than are usually lost due to normal wear and tear. Therefore, no permanent damage will occur when the increase in wear and tear is less than 3 times normal. If amiodarone causes a greater increase than 2 to 3 times the normal wear and tear on the liver, simply reducing the dose or stopping the medication will cause this increase in normal wear and tear to go away. Permanent damage is usually then totally avoided. The earliest signs of liver or thyroid problems are not felt by the patients and are detected by using blood and other laboratory tests. Other side effects that can be felt by a person taking amiodarone, particularly during the first 2 months when 4 to 8 pills per day are given, are slowing of the heart rate, nerve problems, and belly problems. Generally speaking, when the heart rate slows too much, it can lower blood pressure and make a person feel lightheaded or weak. For this reason, we routinely see patients every 2 weeks when 4 to 8 pills of amiodarone are given per day during the first 2 months of therapy. The final problem is nausea. During the initial phase, when 4 to 8 pills a day are given, mild nausea or sickness to the stomach develops. This problem usually goes away very quickly on its own or when the dose of amiodarone is reduced to 1 pill per day. The other important issue with amiodarone is that it influences many other medications. The most common interaction is with the blood thinner Coumadin. When patients develop atrial fibrillation, they are typically placed on Coumadin to reduce the risk of stroke. After 3 to 4 weeks of blood thinning, amiodarone is started to help get the patient back into normal sinus rhythm. Amiodarone increases the effectiveness of Coumadin. Therefore, the dose of Coumadin must be adjusted to prevent the blood from getting too thin. When starting amiodarone, Coumadin levels should be monitored 2 times per week for 2 to 3 weeks so the dose of Coumadin can be adjusted. Amiodarone also increases blood levels of digoxin, beta blockers, and calcium channel blockers. It can also affect asthma medications such as theophylline and certain seizure medications, as well as other medications. This does not mean that amiodarone cannot be used with these other medications. It just means that the doses must be adjusted and the patient watched closely during the initial phase of therapy when 4 to 8 pills per day are given. When used properly under normal physician monitoring in patients who need it, amiodarone will increase the length and quality of life.